Good evening, everybody.
Good evening, sister.
Good evening, sister.
So everybody's doing fine.
Yes,
Today
sister.
we are continuing with the STIs. Last week we covered only the chlamydia. So today we are continuing with what? Gonorrhea. So gonorrhea is one of the STIs. It is also referred to as the club, which usually attack the mucous membranes. Hope you can all hear me.
Yes, please.
The slide is so small. Sister.
Eva, please, my hand is up. I wish to draw your attention to something.
Okay now?
Yes, it's done now. Thank you.
Okay. All right. So gonorrhea is also referred as what the club, and this usually what attacks the mucous membrane. Gonorrhea, it can infect the mouth, throat, eyes, rectum, and can even spread to the blood and joints. This is when it becomes what a life-threatening illness. And gonorrhea is the second most reported bacteria. So with examination, since you are answering MTQs, sometimes it can be questioned which of the three is the most reported bacteria STI. And this should tell you what is bacteria we are talking about. The causative mechanism is of the bacterium Neisseria gonorrhea. So the mode of transmission.
Sister, please, your line is breaking.
Baby during delivery.
Sister, please, your line is breaking.
Yes. That's on vagina and oral sex and multiple sexual
I can hear you.
with the risk factors and most of the signs and symptoms they run. So we have signs and symptoms, and this may appear from one first to when somebody was on the floor before this thing cut.
Sister, please, we were not hearing you. The line was breaking. We couldn't hear what you were saying.
Okay, is it okay now?
Yes, please.
Okay. We thank God that it's okay.
Now.
All right. Okay. So the signs and symptoms with gonorrhea.
The line was breaking.
I think I was talking about the risk factors. And I made a comment that with the risk factors concerning the STI, it runs throughout. Since they are all STI, your risk factor when you have unprotected vagina. Whereas when you have unprotected vagina, you can be infected with chlamydia. The same thing can also happen with gonorrhea and all other STIs. So the risk factors and most of the signs and symptoms they run throughout all the STIs. You should take notes. And we all know with multiple sexual partners, you are prone to all kinds of STIs. So the signs and symptoms. This may appear like from the 1st to 14th day after the initial infections. But in some cases, it may take 30 days. And with gonorrhea, men and women experience slightly different symptoms. But even with gonorrhea, most women even remains asymptomatic. But with men, the men start with a white, yellowish, or greenish urethral discharge. And these are resemble pus. There's also anal discharge, itching, pain, bleeding, or pain. And there's eye sensitivity. Because with the gonorrhea, when it spread to bacteria comes in contact with the area or the eye, can cause a secondary infection. This is even called gonococcal conjunctivitis. This will result to the eye pain, the light sensitivity, or eye discharge. And there's red, swollen, warm, painful point. That is the signs and symptoms for the men. And there is a discharge. This is how it looks like. It resembles pus. So I'm sure you can all see from the picture. And when transmission occurs from the oral sex, that is during sucking. I'm sure most people do. In fact, the men, they do enjoy oral sex a lot. So when it occurs from oral sex, there may be burning sensation in the throat, and swelling glands, itching, and difficult. We should all bear in mind, if the machine is not yours, you need to limit the oral sex. There can be gonorrhea of the throat. So we should all be careful and create awareness. No oral sex yourself. This could result into Then with a woman, there's painful sexual intercourse, fever, yellow or green vaginal discharge. That's why I said with the signs and symptoms, it runs throughout. When we talked about chlamydia last week, we did talk about some of the same symptoms. So it runs throughout. So we should all take note. There's swelling of the vulva, that's what otitis is. Inflammation of the vulva. We've already talked about that. There's also heavy period. That is when the bacteria spread uterus can lead to heavy periods. There's also spotting after sexual intercourse. So bleeding after intercourse, vomiting, we've already talked about that. The diagnosis of is endocervical swab. 4 CS, that is the culture and sensitivity test. Please, as we move on, if you have any question, you can ask as we move on.
Sister, please, your line keeps breaking, so it's very difficult for me to hear you.
Is it okay now, please? Hello?
It's better. It's better now.
All right. So with the management, that is for what? No, we are sure. I'm sure. How good at reassuring our patient. We are treatable. STI to spiritual explain the condition to them. Let them know it's treatable. Yes. So general examination of the client, example of public examination. Then we screen client for even other STIs. And treatment should be started as soon as the patient tests positive. And their recent sexual partners should also be treated at the same time. And that is best. This is prevents infection. So after treatment, there should be root testing to find out if they have truly been cured, or the bacteria has been cleared from the system. So after treatment, it come back during the review For 7 days, they need to what? Be retested again. And doing what? The treatment, they're supposed to what? Educate them to wait. 7 days after what? Finishing all medication. Before what? Having what? Sex. So go hand upon coping them. So during the management, you should need to what? Hold on what? Sex. Treat it. So to avoid getting infections with gonorrhea again, spreading gonorrhea to your partner, client and the sex partner should avoid what? Having sex. So you have each what? Completed what? Treatments. When you have complications, there's a majority of infected women show no sign. Like I said earlier, most women what remain what asymptomatic, even though they might be having what bacteria. So with the complications, women with at least what PID, infertility. There's also formation of scar tissue that block what fallopian tube, and this will definitely lead to what pregnancies. So because women, this is serious because most women remain asymptomatic. By the time we realize, it means more harm has already been what been done. That's why the ABC method is very, very what necessary. Abstinence, if you can't abstain, it means you have to be faithful. Or what? Condom what? Use. So we should create what? Awareness. There's increased risk for what? Premature labor or stillbirth if left what? Untreated. And long-term problem for abdominal what? Pain. So those women who have been reporting to the facility complain of abdominal pain and others, we should screen them for what? STI. So in men, the males, they develop inflammation of prostate glands, the urethra or epidermis, that's the inflammation of the tube which carries what? Dispense. That can increase your risk of what? Acquiring or transmitting what? HIV. It go hand in hand. So with babies, can cause what? Joint infection or life-threatening what? Blood what? Infection. And these days, midwife, we are doing good. The subsequent care, there's an eye care that we treat with chlorphenicol and what? Tetracycline what? Yeah, which is very good. This helps to prevent what? Neonatal what? Yeah. Right. So prevention. The prevention is what? That's creating what? An awareness. Education. The ABC method runs through all what? STI. By creating your be faithful to your partner and condom what? Use. We're moving on to the next one, which is what? Syphilis. We move on. So syphilis is also what? Bacterial infection, like the what? Gonorrhea. This is usually spread by what? Sexual what? Contact. But syphilis, it starts as a painless so the syphilis
Sister, please, we can't hear
starts as
you.
a painless sore. It's typically on or around what? The external in the vagina, around all the anus, or in the rectum. Is it okay now? Those complaining you can't hear me. Can you hear?
Yes, yes.
me now.
That's
So
clear
your
now.
network is not good at all. Hey.
Sister, it
Hello?
breaks. It's on and
It's not
off.
good at all.
Sister, it's okay. It's okay.
It's okay, Sese.
It's okay. The protective organism of Treponema with the pallidum is a protective organism for syphilis. You know that syphilis is also what bacterial or infection. But the mode of transmission is through what person to person during unprotected one. For the oral sex. One play music at the background, kindly mute yourself.
Please, we are in Koto. Do you know we are in class?
You are disturbing.
Anyone who knows her should call her. If she's not ready, she should move out and let us go.
The mode of transmission is passed on from person to person, that is during unprotected vagina, anus, or oral sex. By direct contact with a secreted spot, which is known as what? While having fun at the background, kindly mute yourself.
Mute everybody.
Faustina
Mute everybody.
Nobel, please mute yourself.
So when you come into direct contact with a syphilitic sore, which is known as the cancer, it's also a mode of transmission. Then from what an infected mother to her what a fetus. The birth transmission is not common because these days there are machines that can do what blood.
Please, anyone who knows Sister Christy should call her and tell her she's not aware. Thank
Get for your car. Take this food and go to your post. This isn't right.
Please, co-host, can you mute them? Or there's no co-host.
What do you mean by that? What are you trying to do? Call my boss, of course. And tell him what? Stop it. Someone cannot joke with you. Besides, you know it's supposed to be a surprise. But yeah, if that will make you happy, eat here.
So let's continue. So the risk factor for syphilis, like I said, it runs throughout multiple what sexual partners, pregnancy women, sexual in people with what HIV or infections. The incubation period for syphilis is 9 to 90 days. The average time is 21 days before the initial signs and what symptoms. We should take note of the incubation period. Syphilis is 9 to 90 days. Average time is 21 days before the initial signs and the symptoms. And the stages, syphilis, they have stages. The signs and symptoms may vary depending on which of the 4 stages present. So with syphilis, we have 4 stages of syphilis: the primary, secondary, the latent, and the tertiary. So with the primary, that is the first stage of what? Syphilis. And these are characterized by what? Formation of a small painless open sore or ulcer. That is the cancer on the genital. Now,
Oh, cephalitia. Cephalitia.
Occurring around the area of what? Insect. So the cancer usually
Mine is not good at all.
Sister, please, we can't hear anything.
avoiding anal sex, especially with what the homosexual. It means the cancer is going to over the rect.
Sister free line so. Network na booting.
Sister, please, you have muted yourself.
Understand me now when you be Kofi Kola na ipe wo se ni etia. There is no papa o be ma sewa. Okay, come on,
Sister
Susan.
Barbara, please mute yourself.
Barbara Moaten, please.
Ah, Kofi Ayeden.
So with the syphilis, like the secondary what? Syphilis. The skin rash begins on what? The trunk, but eventually they covers what? The secondary syphilis may appear as rough. They are sometimes red or reddish brown spots, both on the palm of the hands and the bottom of what? The feet. And this rash is usually not itchy. And they may be accompanied by what like sore or what? Lomata what? Data in the mouth or genital what? Area. And there are other symptoms that accompanies what? Sometimes there is fever, malaise, loss of appetite, also a joint ache and what? Swollen what? Lymph node. Vision change, hair loss. The symptoms of the secondary
Sister, please, we are not hearing anything. Your line is breaking. Your line is breaking. Oh, yeah, we are not getting
it.
it.
Is it possible you change your
Yes.
location?
So there might be people who might
Can you
experience
shift
some
to
later it
second?
goes and what come back rest what latent and possibly later.
Sister, we're muting him. We're muting him.
So the third one is what the latent what phase. Eunice, can you hear me now?
No, sister. That is why I
Hello,
even
Eunice.
raised my hand. Hello, sister. Please, we could hardly hear you. So I was wondering if you could adjust yourself. We are not hearing at all because we're on the primary, I think the stages or something when the line went off. And currently we are on latent syphilis. We are lost.
Mm-hmm. So it means you didn't hear anything.
Sister, all
Pastor,
of
didn't
us,
hear anything at
all
all.
of us,
All
we
of us.
didn't hear anything. We were on the primary and then your line went off. And then it came back and we are at latent syphilis. We did not hear anything.
We didn't hear
It's okay now.
anything.
Sister, please, it's still breaking.
It's still the same.
It's the same. Hello.
Hi, hi, sister.
It's okay now.
Yes, please.
All right. Hope you cannot hear me now. All right. People were saying there were lots. So I'm going back to the secondary what syphilis. With the secondary what syphilis, the skin what rashes on what the mucous what membrane. Rabba, your hand is up. Mm-hmm. Rabba, talk to us.
Sister, please, so when we go to the complications of syphilis,
Rabba.
I saw it to HIV. Please, can you explain further? I don't understand.
When we go to where? Come again.
When we go to the complications of syphilis, I saw something that it can lead to HIV, and I don't understand. Please, can you explain further?
Sister, we've come to secondary syphilis. We will go there. Let's sister
I'm
reach
get
there
your question,
before.
so can you come again? So with us, Araba. So
Yes,
with the
sir.
secondary word, syphilis, the entire body, even the palm of the hands and the soles of the feet. This characterized rash bacteria enters what the body. So there is what rashes around what all the mucous what membrane. There is sores in the mouth, vagina, or anus. And the secondary syphilis, they occur approximately 4 to what 10 weeks after what the primary what infections. The skin rash begins on the trunk, but eventually covers what the secondary syphilis may appear, but eventually the entire what body. The syphilis what the secondary syphilis may appear as rough, red or reddish what brown spot that is both on the palm of the hands and the bottom of what the face. That is the color of what the secondary what syphilis what rash. It might be red, reddish brown spot on both what palm and what bottom of what the feet. And this rash is usually what not itchy. It may be accompanied by what like what sore or the condylomata what beta in the mouth or genital what area. They might be accompanied by some of these what symptoms. There is fever, malaise, loss of appetite, muscle ache, joint pain, and what swelling what lymph nodes. Tries to have vision what changes, and there's also what yellow. But with the secondary what syphilis, with or without treatment, they might what go away. Sometimes the rash, some of all this, they will come and guess what? Just disappear. Within some what few weeks. Others they do will come along, repeat itself as long as what year. But without what treatment, the infection will progress to what latent and possibly what the tertiary what stage. So the early detection is what better. Should diagnose. But when they come, they complain of all. I get rashes, is come and it go. It means what it should give us a clue. Further. So we are moving on to the latent what stage, and this is the third what stage. With the latent stage, there are no signs of symptoms of what the syphilis. So when they enter into the secondary and the rashes are coming on and off and they go without treatment, it would definitely lead to what the latent stage when all the symptoms what. So without treatment, even though the person might still be a carrier of what the bacteria. So without treatment, the infected person will continue to have what syphilis in their body, even though there are no signs of what symptoms. And with the latent phase, they are what divided into two. We have the early latent what syphilis. And what this the early latent syphilis past what 12 months. The late latent syphilis, it will occur more than what 12 months.
Please again.
Then I'm saying with the latent phase, they are out. At this stage, there is no signs and they're divided into two. We have early latent what syphilis and late what latent what syphilis. The early the infection has occurred more than 12 months ago. Within the early is what within what the past 12 months. And the late is more than 12 months. That means with the early latent is within what a year. The late latent is what more than what a year. Now the latency can last for years. And the signs
Josephine, you pop.
Shay Josephine. Shay Josephine. Come on.
Let's show you what stage. So let's know age. There is no signs and symptoms. The early latent treatment more than what 12 months.
It's within 1 year, 12 months.
Have what 12 months. You should take note that the latent symptoms can last for years. Signs and symptoms may never what return. And this may progress what to what tertiary what stage. So this is finally the tertiary what stage. So the tertiary stage, the tertiary, that is the late what syphilis. So about 15 to 30% of people with syphilis who don't get treatment, they will develop complication known as what the tertiary or late what syphilis, and this may appear 10 to 30 years after infection, and this can be what fatal. It can also affect what multiple what organs what system, including the brain, the nerves, eyes, the heart vessels, the liver, and what others. And the symptoms of tertiary syphilis very depending on the organ system what affected. And at the tertiary what stage, syphilis are not what infectious, but they are still what treatable. Even though they are no more what infectious, they are still what treatable. So we have 3 different forms of tertiary what syphilis. We have the comatose what syphilis, and then late what neuro what syphilis, and cardiovascular what syphilis. A minute. So the 3 different forms of tertiary syphilis, we have what? The comatose syphilis, the late neurosyphilis, and what? The cardiovascular what? Syphilis. So the comatose syphilis or late benign was syphilis. It usually occurs that is 1 to 6 years after what they need initial infection, with an average of 15 years. So this should tell you how deadly syphilis can be when it gets to what the tertiary stage. We have the neuro syphilis. This refers to an infection involving the central nervous system. early in either asymptomatic or in the form of syphilitic meningitis. And at the graph, the late also neurosyphilis was 25 days afterwards initial infection. And the last one is a cardiovascular syphilis. This occurred 10 to 30 years afterwards the initial infections. So assuming you just went in just for one sex, you have to suffer after 10 to 30 years. And the most common is hepatitis, which may result in aneurysm formation. We should be extra careful. Early screening is better to prevent all these complications. We do have congenital syphilis. The baby born to women who have syphilis can become infected. Syphilis can cause barrier and affect our babies. So two-thirds of syphilitic infants are born without symptoms. And most newborn with congenital syphilis have no symptoms, although some might experience a rash on the palm of their hands and sort of with midwife examination of newborn. So during some of this examination, you should look out for some of these signs to rule out if a baby is born with genital syphilis or not. The later symptoms may include enlargement of the liver in the spleen. Sometimes you can cause deafness, lung inflammation, and teeth inflammation. Screening early detection is very, very important. And who is at risk? Everybody is at risk. So far as you are active, you are sexually active. Everybody is at risk for all the various STIs. So we do have pregnant women, people with HIV, people who are at greater risk of pregnancy, including men who have sex with men, and people in prisons. And those who have sexual far as you are sexually active. When you have diagnosis of the syphilis, you have the direct testing. That's when they use the background microscope of the serum fluid for the cancer. They take some of a specimen from the cancer, that is the soul. That's classified under the direct testing. And this give immediate diagnosis. I think it's within 10 minutes of acquiring the sample. This gives an immediate diagnosis of syphilis. And physical examination. All these help for the diagnosis of syphilis. There's the echocardiogram, the LTEC, the cardiac characterization to look out for the major blood vessels on the heart. They also have the spinal tap. That is when the lumbar puncture. This collects the cerebrospinal fluid check for infections and others, or inflammations. So the treatment is determined by the length of the time the person has been infected. So we've talked about the 4 stages. There's a primary, secondary, the latent, and the treatment.
I'll be back. I want to hear out.
Disturbing us. Determined by the length of the time. So the first thing that we always do is a reassurance and explanation of your condition to the client. Uncle, mute yourself. So prenatal screening for syphilis for both the client and her recent partners. for treatment using what? Antibiotics. This is what syphilis is, a bacterial infection. You should all take note. So the syphilis screening test should be repeated during what, the third trimester. Do we do that? Midwives,
No, sister.
the syphilis screening, do we do that?
No, sister.
Yes, we don't. But we should. Rebecca, also your hand is up.
Yes, sister.
We
We do.
Yes, sister. My hand is up because of the treatment. You said we should screen the client and then the recent partner. So I wanted to find out, because the person is a recent partner, wouldn't it be possible that the person has taken from the previous partner? But why rather the recent partner? Does it mean that
we are saying the recent partner because this is the person's parent partner. This is the person is engaging in sexual activity. You can't call for the person to go for the ex. Hey, my friend, go and bring your ex and let me screen. No. They will always ask for what? The parent partner. So that you test the person and you screen and treat. Prevent further or reinfection. So assuming somebody has slept with 20 men, they are positive. Can you ask them to call all the 20 men? Becky, is that possible? It is advisable the parent partner. It is the same person, the person is going to have fun or sleep with the person. Becky, I hope I've answered your question. Rebecca, are you there?
Yes, sister, I'm here.
Have I answered you?
Yes, please. Thank you.
You're welcome. So the syphilis screening should be repeated during the third trimester. That's 28 22 gestation and during labor. And I'm sure we are all guilty because we don't do that. Ida, your hand is up.
Yes, sister. Sister, now the HIV test kit is 2-in-1 for both HIV and syphilis.
Oh, okay.
So some of my sisters haven't realized it.
Okay. So now brother is saying that the test kit, there's a cassette, right? It comes in two forms. Yeah, it comes in two forms, both for syphilis and HIV. When we are screening for the HIV, we should also screen for the syphilis. Since there is 2-in-1, means it is the same cassette that you used screen for the two tests. So we should all take note. And so Sister Vida, thank you very much. Okay. And Naomi, your hand is up.
Yes, sister. The common sister Vida talked of. I realize when you do it, it's always negative. But when you are referring the client for routine labs and you happen to add it, they will come with positive results. So I'm always contemplating, is there something wrong with our the test case they are giving us? Because I got 3 clients and the results came and they were all positive and we treated them. But when I did with my HIV test kit, the combined one, it told me they were all negative.
All negative.
Thank you. Yes.
Thank you much. Who else has experienced that? Frida, talk to us. Frida.
Hello, sister.
Yes, please.
Please, with that one, I think you have to wait for 15 minutes reading the results. If you should wait for 15 minutes, sometimes you see the faint line there. And then, sister, one thing I wanted to ask, please.
Hey, network is too bad. I can't hear
one client registered them, and then during the network either. Hello.
Wait, I didn't hear anything. Oh, come again, please.
Hello, sister.
Yes, please.
Please, I'm saying that with the combo, you have to wait for 15 minutes before
15
reading the
minutes.
result. Yes.
Oh, okay.
And then, but I have
So
a
that
question.
Okay.
So, I had a client who tested positive for syphilis during registration. So she was treated. And then later when we were doing she was treated with the partner. So when we were doing the 34 weeks on, we realized that it was still positive. So I was worried. So I asked the specialist and he said, oh, for that one, since it was treated, there's no cause for alarm. It's some way for me. So I wanted
no
some
cause for
clarity.
alarm. Like during the treatment, did you educate your patient? Or during a treatment, they are supposed to be aware of sex.
I educated them.
Okay, so after the treatment, did they come back for retesting? Did you do that? After treatment,
he was saying that like when you retest, it will show positive, even though it's not positive. That's what he was saying, but I didn't understand. No. He said once she has been treated, there is no cause for alarm.
No. We can't accept that, okay? And why is there a need for them to come for retest? Because after treatment, you advise them. Now, what is the need for what? The retesting? After what? Screening. They have to come for what? When they are what? Being tested as positive. During treatment, you need to educate them and their partner to stay away from sexual intercourse. Because so if you don't educate them, they will. As they are even treating themselves, they will still be having sex. They need to come back for retesting. So we will know if the bacteria has been cleared from their system. But after treatment and they are still positive, and you are saying, no, because they've been treated, there's no cause for alarm. No, we can't accept this. Okay, Frida. I don't know who asked that question.
I was worried though, so I consulted the specialist, and he was telling me this.
Oh. Why is there a need for retesting? No. Even they didn't take even the drug as what prescribed. They didn't even also abstain from sexual intercourse. Because if you have a disease you treat and it's still positive, then why are we treating in the first place? Faustina, hand is up.
Yes, sister.
Talk to us, please. So who has come across the same scenario? Faustina.
Now what's sorry and the pani too. Funu your beer can now I sorry.
Hand is up, Doris.
Adriana. Sister, please. Yes, sister, please. After treatment, how long does it take for the bacteria to be out of your system?
We believe 7 days. Okay. That's why you come back for treatment after what? You come back for retesting after what? The treatment. During the 7 days, bacterial infections. It should wear out from what? The system.
Okay, so sister, thank you.
It means something went wrong. And during treatment, we should educate them to stay away from sexual intercourse. should abstain. One Wikipedia, and your shade. Adrina, your hand is up.
Yes, sister, I wanted to say that usually some of the doctors will say that after treatment, the antibody will still be in the bloodstream. So retesting it again, you will still get positive, but the patient is treated. And sometimes they would even say that it can take many years for it to disappear from the bloodstream. That is the antibody. So for those who would probably test again, some people might be in their incubation period whilst you tested. So you tested, they are negative, but probably they were in the incubation period. That is why you are getting negative. So you might repeat to probably catch those we couldn't get earlier on who probably have it, but were in their incubation period and we thought they don't have. So that is why we might probably recheck. But for the treatment, you treat all right, you test again, it will still be positive. So you leave them maybe after delivery or something. It's taking a quite some time for you to come back and recheck. But immediately after treatment, probably their next review, it will still be positive. So this is
like
what
you are saying, like initially those in the incubation period, fine, if you're in the incubation period, the test is going to what result in what negative, right? That is why we are even advocating that those who are even negative, there should be a repeated test during what 28 to what 32 weeks. But for instance, if they were in their incubation period, at least during 28 to 32, at least we might what find out. But after treatment, why should they still remain positive? And why do we do redirect testing for? A syphilis is a bacterial infection, not viral. So it's treatable. It is what treatable. So we should take note. And the education here is key. During treatment, their partners need to be treated, and they should stay away from what? Sex. Oh, Henrietta, your hand is up.
Yes, sister, please, I want to find out if it can be treated in the first trimester.
Why not?
Okay, thank you.
The tertiary stage is still what? Treatable.
Okay.
Syphilis is treatable. Please.
So please, even in the first trimester.
Pregnant women receive what? Penicillin, that is the treatment of choice to treat. I'm sure we all use the benzathine penicillin, right?
Hello, sister.
Yeah, Faustina, your hand is up.
Sister, please. I'm talking about the treatment and then recheck being positive. Does it mean that we are not giving the client the correct dose or hot? Because I have experienced some with the one client. All the pregnancies, she tested positive after treatment. So I don't understand.
How were you educating them? Educators. Oh.
Sister, please. She's a married woman, and then according to her, she's staying with the husband alone. So
we have married women who also have side men. Like now, the men have side chicks. So you can't just say the person is a married woman. For example, somebody can stay with their husband and have 4 kids. And at the end of it, there will be a DNA, and none of the kids belong to the man. The fact that the woman is married doesn't mean she is faithful to the partner. Faustina.
This man, yeah, in fact, I trust her small.
You can't trust anybody, my dear.
Oh, she's not that young.
So you can't trust anybody, okay? Yes. My fathers are having kids. You can't trust anybody. And they are going to have the who announced
If the old lady
pamphlet.
cheat than the small girls.
Yes. And now nobody and this thing is done in closed doors.
Sister.
Because see, with your
Sister,
trust
please,
issues, you
this
don't
is
accept it.
easier to my.
The trust issue, you accept it here. Because these days you can't trust anybody. Okay?
Sister, please, let's assume that the client is taking to the husband. So then how do we tackle this issue?
Oh, as a midwife, our job is to create what awareness and educate women, not just on syphilis, but on all the STIs. We are going for the ABC what's method. The first one is maintenance, the second one is to fix your partner, and the third one is make sure you protect yourself. Condom. If condom is the only thing that has a dual what protection against pregnancy and what prevent you from what all these STIs. That's midwife. You can't force somebody. Oh, our job is to create awareness and educate them. So you can't trust somebody. Hey, I trust this person much. That's why we get shocked. When we give trust our men. My man would at the long run check his phone and all kind of messages. I feel not fast. So first thing, don't trust anybody. So let's move on. With the pregnancy, when we give do what the pregnancy is what the treatment of what boys. This prevents mother to child what transmission. The preparation and treatment duration varies for different what stages. For the primary, secondary, and early latent syphilis, that is less than a year. We get the 2.4 million IM of benzathine penicillin G in a
Sister, your line is breaking, though. We can't hear you well.
Oh, the network is very bad. I don't know why every Saturday it wants to rain. The rain wants to rain at my end here. So for the primary, the treatment of choice is what penicillin. The preparation and treatment duration varies for different what stages. We've talked about the primary, secondary, the latent, and what the tertiary. So for the primary, secondary, and early what latent. The early latent, we talk about 2 types. We have the early latent, which is within what 1 year, and the late, which is what above 1 year, that is 12 months. So for the primary, secondary, and early latent syphilis, it's less than a year. 2.5 million units. That is AM of what benzathine penicillin, which I'm sure we are all familiar with this word drug. It's given in what single what dose. So latent infections over a year and latent infections are or unknown what duration. That is when we give the 2.4 million units of IM benzathine penicillin G in 3 what doses. That is each at 1 week interval. So in all, or total is what 7.2 what million what units. And it's given to all stages of the syphilis, except what the neurosyphilis and what ocular stages in what it cures what. The ocular stage and what they give what the crystalline what penicillin G as 18 to 24 million a day. It's administered at 3 to 4 million intravenous every 4 hours, all continuous infusion. And it is done for what days. So there's also tetracycline and all the ceftriaxone. And 500 IM for 10 days are alternative for choice for those who are allergic to what penicillin and due to what the risk for birth defect. These are not recommended for what pregnant women. So the doxycycline and what the others, doxycycline, tetracycline, and ceftriaxone. These are not recommended because tetracycline cannot be used because it is toxic what to the fetus. One is up. Yes. Daddy. Can I talk to us? Your hand is up.
Good evening.
Evening, yeah.
Please, I would like to know with the benzathine, I meant when you give the 2.4 milligram to men, that when they take the 3 consecutive times, it could lead to low sperm count. So I would like to know more about that.
I don't know, Achasa. Is there anybody who has also learned about that? Time. Hello, there's a question on the floor. Benzatine penicillin causing low sperm count. Is there anybody who has come across that?
What I know is that it's just for a period of the treatment. After the treatment, some weeks after it, he regained the sperms.
How do you test for the week, during the week? How do you know? Like maybe after this administration for 2 weeks, the man is experiencing low sperm count.
They say a week later. A week after the treatment.
Yes, the question is on the floor. Who has also come across that?
The question again.
Low sperm count.
Please, so the benzathine is given to the pregnant women or both the man and the woman.
Yes. Yes, has anybody also come across that? Well, like you're saying, it is true, okay? Yeah. It's not only benzatine that have that is linked to lower sperm count. Even others, other antibiotics. Some of the antibiotics affect the what? But it's temporary, okay? Like you're saying, it's not only even that. Sometimes it even result to what? Lower desire or what? Arousal for what? Sexual what? Intercourse. And also can possibly even result to what? Delayed what? Ejaculation or orgasm. So like you're saying, it's true, it is linked to what? Lower what? Sperm count. It is just temporary and it's not just benzatine. Most antibiotics are linked to what? Even lower what? The desire for what? Sexual intercourse. Some also even delay what? Orgasm or what? Ejaculation.
Thank you.
The effect of syphilis of pregnancy. Oh,
Madam,
you're
please.
welcome.
So after treatment, how long will it take for the person for those symptoms not to do again?
Benzatine, how do we do? Because this is okay. This, I know all midwives are familiar with benzatine, right? How do you give it in your facility? Share with us. For midwives, we are prescribers. As soon as madam, there's a drug here, we even refer them to the medical officers. And the ones who treat, right?
Is this control officers also do give the injection?
Yeah. It's okay. We are in class. Yes, how do you treat? Sandra Terria, mute yourself. Midwives, how do you treat syphilis?
Sister, syphilis is being treated by the benzatine penicillin, but it looks like, yes, please, but it looks like, to me, what I've seen is that to my facility, it's like all those that have seen at the labor ward or in the line-in ward. It's like they're negative. So I was actually confused with it. It has been treated during the antenatal before the person gets to me. But I've never found out. Those that have seen is always
the time. It is detected at the ANC. Most of the time when they come, we are advocating that we have to repeat it 28 or 32 words, so that at least we can even note those who were even in their machine was doing what cooking. What is the familiar choice of treatment is what that is what we use to treat. So let's move on to the effect.
Please, does it mean that the benzo we can still use it during the antenatal without the labor and then the delivery?
Yes. Yes, we can use it. Syphilis can travel from the bloodstream across what the placenta and infect the fetus. That is anytime during what pregnancy. Or syphilis can what cross the placenta barrier. And it increases the risk of preterm and intrauterine growth or restriction. Some babies with syphilis whose mother are not treated develop what visible problems that are visible on what ultrasound.
Hello.
Yes, there's a hand up. Read that. So some babies with what syphilis whose mothers are not treated, they are not treated what that are visible on what ultrasound. Such as we have sometimes there's what large what placenta, fluid in the abdomen, what other abnormalities, skin rashes and what others. These are all effects of what syphilis during what pregnancy. And effects during what labor. It can lead to what fetal damage, low birth weight, and what vertical what transmission. Also, cardiovascular what complication. We have destructive complications of there's neurosyphilis and what congenital what syphilis. So prognosis of syphilis. Late syphilis may be what permanently what disabling and may lead to what death. So prevention. The prevention is what public what education. That is what creating what awareness. Screening all pregnant women should be screened during what the ANC what. And subsequent screening should be done at what 28 what 32 what weeks. That should be thoroughly what screened before what transfusion. Then correct and consistent use of condoms to reduce what the risks when they are source of what genital. Practice what safe sex. Yes, Abdullah, your hand is up.
Now, please, with the babies born to syphilis mothers, would they also be given any treatment?
Yes. Syphilis is what? It's a bacterial infection. So they are also giving what? Antibiotics. Hope I've answered your question. Kasim, talk to us.
Please, with the for the syphilis, you mentioned about the negative facility, they give it 2 times. The first one will be given a week later, they will give the second dose. So how is that one? Like
kindly come again, okay? Asim, I didn't hear anything. Oh.
Sister, I'm saying that with the treatment of the syphilis, you mentioned that the benzathine is given once, but the facility that I worked in, they give it 2 times. The first one is given, then the second one is given a week after the first one. So I want to know, is it that does it depend on the stage of the infection or?
Yes, it depends on the stage. Primary, secondary, and early latent. The early latent, that is what? Within what? 12 months. The 3 doses are what? Late latent or unknown what? Period. I'm sure your facility, they are administering the 3 because they are using the unknown what? Period. Okay?
Okay, sister, thank you.
You're welcome. So early treatment for primary syphilis before it develops is what? Secondary what? Stage. And if you notice any unusual sore or rash, especially near your genital or anal area, stop having sex and seek what? Treatment. So assuming the person is a new partner and you want to perform oral sex, and you see there's a scratch, again, run away. Make sure you seek for treatment. And you notify all of your sexual partners. Assuming you have side men, side boy, you need to notify them. Hey, it's an alarm here. We all need to get what? Treated. To prevent what? Real what? Infections. Yeah, Asana, your hand is up. What?
Yeah, sister, please. My question has not been addressed. The question about after treatment of the benzathine, how many weeks will the client get a quality sperms? Because I'm looking at people with
I'm talking about the lower sperm count, right?
Yes, please. So when you have a client who comes for preconceptional counseling, so if you want to counsel the client on if they tested positive, how do you now go about it?
I'm counseling them on the low sperm count. At least it might resolve within about 12 weeks. At least 12 weeks. Okay, and it's not only the benzathine. Most antibiotics. There's a link that they all what? There's a link to what? The lower sperm count. Okay, it is not just benzathine. Most antibiotics, at least majority of them, and not just low sperm count. And there's delay even orgasm, delay ejaculation. It even decrease what our arousal, our appetite for sex. So it's not just what lower sperm count. And after 12 weeks, everything will go back to normal. It's 12 weeks. Okay. Yes, Asana.
Thank you, madam.
I wanted us to treat about 3 topics. Network didn't favor us. So let's quickly run through what psoriasis. That is the 3rd one. This is a very common sexual transmitted infection that can be carried on for long period without symptoms for causing considerable symptoms. They can be present at vulvovaginitis. We talked about vulvovaginitis some weeks back. So that has what current and what offensive what discharge. Christina, your hand is up. So with the trichomoniasis, this is a protozoal what infection. Please let's get to know the bacterial infection, protozoa, and what virus. For some of the MCQs, you'll be asked which of the following is a bacterial what infection. Learn to differentiate what the bacteria and what the others. Let's first talk to us.
Yes, sister, please. My problem is about the treatment. Now my facility and with the new ANC book we are using, the lab request physician, the client, we ask them to do VDRN. And in my facility, when you go and do VDRN is possible, then we begin the treatment of benzathine penicillin. So I just want to find out if it is the right thing we are doing. Because the previous lectures and so today, meaning that the VDRS is not only for syphilis, it comprises of only some of the
So kan keji na ka to. So nyabela missionary ka ngbalde ba wujwe. Aka. Say 1270 ya dem po. Kala kan ya na fa. Ne ba ka geji na fa. Wala ne ba na ha.
Yo, Fosti.
Yes, sister.
Ama de no ka ba ku fora.
Sister, please, I wanted to, I was
looking
for some clarification. I said that in my facility, when they come for routine visits, the pregnant women, we allow them to go and run some labs. So when you come and the BD are positive, then we commence the treatment of benzodiazepine penicillin. So I want to find out if it is the right thing we are doing, because the previous lectures and today, the VDRS is not only for some of it comprises of all the sexual transmitted.
Sister Rahina, please mute yourself and let's hear whatever is going on.
So sister, I want to find out if it is the right thing we are doing over there. Thank you.
Get your question.
Network.
VDRL as one of the routine lab investigations at your facility. And what happens after that? Come again.
I was seeking for clarification. I said that the previous lectures and today I've learned that the VDRS comprises of most of the sexually transmitted infections, and which syphilis is one of them. But at my end, when you come and you do VDRN and it's positive, you don't go further to find out which one is actually causing that problem. Then we begin the treatment of benzodiazepine penicillin. So I want to find out if it is the right thing we are doing over there.
Yeah, so on the safer space, I think it's the right thing. Okay. And with this VDR, like you're saying, it is not only just for what? Syphilis. At least it is positive and treatment is what? It helps to clear all other what? Materials, okay? Because we do have the non-treponema test and what? The treponema what? Even if there's what? False positive, ideally we are supposed to go in for what? The treponema what? Test. This is truly what syphilis or is what different what infection. Like you're saying, I think let me say Africa. Some of these things we don't do that. Okay, at least if the treatment is commenced to be on the safer side, I think it's best that way. But most facilities even don't have what some of these what lab what machines to even do what investigate more. It's a red light. When they commence treatment, it will help clear what bacteria what. Okay, first thing, so it is best that way.
Okay, thank you.
Just what neglecting what the woman.
Okay, thank you very much.
So with the tracheal pneumonia, so this is a protozoal what infection, and it's called the positive organisms of tracheomoniasis what vaginalis, and the infection is what from 5.8 what days. And a clinical what manifestation. The tracheomoniasis is associated with what the vulva what vagina. That is what the division of both the vulva and what vagina. There's a foul smelling what vaginal discharge. It might be 40 yellowish green or gray. There's dysuria, dyspareunia, genital itching, and lower what abdominal what pain. So good history taken in what physical what that's the diagnosis. Good history taken in what physical what examination. I now what yeah, I mean, sometimes I've come across some of these. There's a moment they come for operation, and you need to listen to the speech. What would you pray for? What I ask them? Say where they say, oh, yes, of these are what STI. Well, what people now? I say, oh, most of this STI is when you that is smell those what those what products are coming out. You should screen them. But the trichomonas is what it has a foul smell. You should take what high vagina or swab. Some of what these ones. So the preparation is to abstain from sex. The ABC was method, but the STI it runs throughout the what prevention. To abstain, be faithful and what practice what use condom use or safer sex. When you talk about safer sex, we should take notes during your education. Now people are practicing anal sex. I can't say whether it is good or it is bad, but there are even married men who are even having anal sex with their wife. So our duty is to create awareness. If you are going in for anal, make sure you go in for anal. Don't mix vagina and anal with sex. If you are going for anal, make sure after the anal sex you go and wash down before maybe you want to come in front. We shouldn't what mix these two, as we carry what bacteria from what rectum to what the vagina, and that could what disastrous. So during our health education, and we go out on our outrage our teenagers, they are curious and they're experiencing so many things. We should what make them aware or make them know the consequences of practicing some of these what practices. We should take note. Treated with medication. As metronidazole. And we have alternate what regimen. This is 72. So with trichomonas is a total what infection. It's been treated with what metronidazole and what letinidazole. And both partners must be treated to prevent what infection. You call STI as soon as the person is what is detected. The person has to invite his or her what a partner for also what and treatment to prevent what infection. That is very, very key to prevent some of these. And complication, it leads to premature labor, low birth weight, and babies stand the chance of being infected. And this can increase the one rates of what. But when there are infections, it means your immune defense will go down, and it gives you the opportunity for infection. And it also results what PID. The bacteria what ascend. So we are moving on to genital ward. This is also known as what? Adenocarcinoma what? Not the positive organisms, the HPV type 6 and 11. There are over 100 types of HPV. The genital wards, the HPV type 6 and 11 has been specified, and they are the positive organism of the genital ward. I'm sure we've all come across genital ward before. And most wards are asymptomatic and painless, and they may resolve by what themselves. When present, they appear like what flower. I'm sure those who have come across one is the site is not pleasant at all.
It's not nice at all.
It's, in fact, it looks too bad. Very, very bad.
Seriously, sister. I came across one yesterday. Yesterday, that's Friday. And yesterday.
It is very bad. The site is very, very, very unpleasant. The growth normally affects the perineum, vagina, the cervix, and the rectum. In some cases, in the mouth or lips. There are usually multiple growths that gradually increase in size and growth increase during what? When they get pregnant, one about anyway unity. In fact, the site is very, very what unpleasant. And occasionally they may cause what irritation and what soreness. Infection persists for many years and relapse can occur at any time. So with the genital wards, does not have what permanent what cure. Or is there anybody here who has come across a cure for genital wards?
No.
So with genital warts, they have what? No what? Pure. But sometimes it can remove what? Locally. It's application of the caustic agents that was the polydophyllum once or twice a week up to 6 weeks. There's also surgical what? Sometimes laser was therapy can be used. They have what? The electrode naturally. That is when the warts are being destroyed using what they diatemic. Sometimes it can also be freeze. So that the activity what be distracted and what cause subsequent death of what tissue. So when there's what has no cure, it has no cure. The only thing they can do is what they will try to remove the what. But we should be careful during our outreach. We should what awareness. But I don't know, because I remember I came across one vagina examination. This lady was non-attendant, so just brought in paper. So during vagina examination, she just opened up. One student that was a rotational midwife. I think that was her first time seeing one. She just screamed, was like, "Hey, I can't wait one day." But it was very, very what unpleasant. So we should create awareness. Yeah, because the sites, I wonder, I mean, I think maybe they were having sex maybe in the dark. Because daytime, yeah, it's serious. It's serious. This lady just screamed, "Hey, actually, we wanted here." And in fact, we all like we all laughed because we couldn't control ourselves. And we were not even expecting that. So during our outrage, in fact, we should create our awareness, okay? At least the condom use, make sure you use a condom. Use a condom.
Sister, please, my hand is down.
Oh, okay. Then I'm not seeing your hand. Who is that?
Rebecca.
Rebecca, talk to us.
Yes, sister. If you look at the signs and symptoms, it looks like, I think you've mentioned something asymptomatic and it's painless. So how do we know, or how do we educate the people or the client that if you see these signs and symptoms, or if you see this, you know that this have this? Because sometimes if you see the what, that's a Thursday. You have to do a CS for a teenager. Plenty what? And she's not, we can't allow her to go through a SVP. So, and we asked her, didn't she know that? She said she didn't know.
So where was she attending ANC? That is the issue. No, during booking or like when they come, they need to do head-to-toe examination. Assuming this person is what your client, you have cared for her from booking and now labor has set in, and you never checked the vulva to find out whether there was anything wrong. And now labor has set in 6 a.m. Pick the ANC card, and this lady is what attendant at your facility. What have you done? Or doing what? Visit, because once we don't allow them to go through our vaginal what delivery. So please, midwife, you should take what our examination seriously, head to toe. Please go down there, inspect the area. What is happening there? Is everything okay? Is this woman suitable for vaginal delivery? Sometimes when we don't do that, and at the end of the day, they come in 6 a.m., 7 a.m., you need to prepare them for CS. But it's embarrassing. Yeah. So the doctors will pick the but this lady has been attending what clinic, and nobody detected that there was what. So please, I had to do examination. You should do that. You shouldn't just palpate, listen to the FH. I mean, now how I'm saying, What is your issue? Then we give a routine that you should do proper what examination. Avoid some of these embarrassing words. Yes. Like what you are saying, you have to perform CS for what? The teenager. So the first question, where was she attending what clinic? That is the first question we have to ask. Is the midwife at where what? She attends a clinic, didn't help. But they should be booked. It should be elective. I'm sure most of us have gone through labor pain. Labor is not a simple word. Then it's no joke. So laboring, and at the end of the day, you need to be taken to CS. The trauma is just too much. Yes, a hand is up.
Sister, please, I wanted to find out what is the incubation period for genital warts?
Incubation period for genital warts. Genital warts, there's no incubation period for that. Because I've not come across any incubation period for what? The warts. They are caused by what? The HPV what? So as soon as what you are being infected with what? The HPV type 6 and what? 11. That means what? You are in for what? Trouble. Because they are caused by the what? The human papilloma what? Virus. So as soon as you get into contact with it, you are doomed. I hope I've answered your question. Have I answered your questions?
Yes, please, thank you.
Yeah. But we have so many types of human papilloma virus. There are about hundreds of them. And with the type 6 and 11, means yes, it's trouble for you. And you have to deal with this for the rest of what? Your life. There was another hand too was raised. One pass upon theater. So let's move on to the herbs.
Hello, sister.
Herb is caused by
Hello.
Hello,
Hello, sister. I wanted to say that when you educate them, we should inform them that when they're having sex, they shouldn't be shy. They should do it in the light. So that if there is something wrong, they will be able to see it. Because some of these men, they will be hiding things. And by the time you know, they have infected you. Me having sex in the darkness is not good.
It is because they are stealing. If it is legal, at least the lights will be on. But because they are stealing, breaking in, they'll meet them just by the door. Even some even sleep with them in the car. So doing what health education, at least you should educate them what there should be lighting system. You need to take your time and look at the genital. Where you are going to enter, what is there? Just be doing things in the dark. But there are so many what STI'S. So the genital was, in fact, when you get infection with the HPV, the type 6, get exposed to this type 6 and 11, it means you're going to deal with the word for the rest of your life. So wherever we are introducing on what the men, so there are men among us. Yeah. So make sure you look around. The ladies too, we should also open and shine our eyes and look around. To find out whatever. In fact, we should even hold it and examine it. Hey, what am I going to receive? How does it look like? How does it feel like? Is there any sore, any crack, any bruises around that? Before you allow that. So during the health education, as you are creating awareness, it is best we add some of these things. There are some men, they won't even undress. Yes, they will be in their singlet and their boxer. So the woman won't see anything, which is bad. They should also undress for the woman to also do a thorough examination of their bodies. So let's move on to the herbs. These are caused by what? herpes simplex what virus, and the herpes simplex virus. This was a viral what. So kindly let's take note. The syphilis is a bacterial infection. The trichomoniasis is also what? A protozoal what? Infection. And the genital what is what? The HP type 6 and what 11. Herpes is also what? A viral what? Infection. Kindly take note. It's a viral disease from the herpes or viridal family caused by both the herpes simplex what? Virus. And we do have the what? HSV type 1 and what? Type 2. They do not show symptoms and they can lie dormant in your body for many years before being what? Triggered. The incubation period is from 4 to what? 7 days. And the symptoms may develop anywhere from 2 to what? 12 days after you have been exposed to what? Herpes what? Simplex what? Virus. So the types of the virus, there are two what? Simplex what? Types. You have type 1 and what? Type 2. The type 1 is also known as what? The oral what? Herpes. And this type causes sore or blisters and ulcer around the mouth, lips, and what? Face. And it's also known as the fever blisters or the cold sore. So the type 1 is also known as what? The oral what? Herpes. It's also known as the fever blisters or the cold sore. And the type 2 is also known as the genital herpes. Let's take note of what their names. And this type is responsible for the genital herpes outbreak. So meaning the type 2 is what? Responsible for what? Genital herpes outbreak. Infected person may have sores around the genitals or the rectum. So the mode of transmission of the herpes simplex, it enters the skin or the mucous membrane, that is through tiny breaks in the tissue when there is contact with an infected person. And the virus is a very contagious virus. It can pass from one person to another through direct contact. And also it is important to know that the both SPV1 and 2 can be spread even if sores are not present. So with this, it can be spread whether there is sore or there are no sore. The herpes simplex type 1 is transmitted through oral secretion or sores on the skin. So because it's oral, it is through kissing, sharing of French kiss. It means if your partner has herpes, later you are going to get it. Sharing of objects such as toothbrush and pencils. Now toothbrush, they'll be like, oh, or because of love, they money the treat no balance for no treat. Please, you have to be careful during your health education. With awareness, please, it is serious. In general, an infected and with the herpes, anyone can be infected. Anybody is at risk. Anybody is at risk. So the signs. The viral infection is more common in women than in men. There's a painful blisters that may appear like pimple on the tongue or penis, the shaft, and other parts of the inner thigh. The blisters takes about 2 to 4 weeks to heal. Like when there are blisters, the other formation it breaks, but it takes about 2 to 4 weeks. And with the females, so there's also painful blisters. That also appear just like the pimple. With the outbreak of the genital head, the person may respond like symptoms. So it comes along with the fever, chills, headache, body aches. I'm sure we've all learned
so maybe you don't know whether they give the person
kindly mute yourself.
Yes, because yes.
This has becoming too much.
I just So diagnosis is physical examination of the body for salt, and based on the signs and symptoms. Then what? A CS, that is culture and sensitivity test, from the fluid from what the salt. And blood test, laboratory test, and what? The serological test. And all these can help to diagnose what the hep what simplest what infections. So there is what recurrence of what the hep what simplest. After the initial outbreak, the virus travel the nerves and reside in the nerve tissues within the body. So reactivation of the repeat occurrence of the blisters can occur throughout an individual lifetime. So the helps to it can what one person can experience what repeated what occurrences. And the health genital caused by the HBS2 of the average 4 to 6 times what a year. That of the HBP infection occurs only once.
Off your mic.
Christiana,
ready.
So management, the cure for hep has not yet been developed. That is why there's real occurrence. So some of these STIs are very, very dangerous. There's no cure. So when infected, the virus remains in the body for life. So recurrent infection, as we talk about the outbreak, they are described. Some comes along with aches, pains in and around genital area, or burning pain or difficulty in urinating. After several years, outbreak become less severe and more chronic. And some people will become perpetual, though they may still be contagious. The fact that the person look fine, is healthy, the person could be a carrier of herpes. And now there's condom that protect us from STI. What can we use to also protect ourselves from kissing? Hello? Is there anything?
No.
Is there anything we can use to prevent that? Is there anything we can use to protect ourselves from that? Since most of these STI are also oral.
Abstinence.
So abstinence is best there. Okay.
Oh, that's the best.
You all vote for abstinence.
Yes, sister.
Mouthwash.
Hello.
The use of condom.
The use of what? Yes, come. Yeah, talk to us. Somebody was making a point here. The use of continue for us.
Yes, I'm saying the use of condom.
I know condom. Like I'm talking about kissing.
Nothing can abstain.
So with the kissing, what can we do to protect ourselves?
Sister, the use of condom in the sense that if you are really trusted in the man and the person uses the condom, at the end of the day, it will be removed. But sometimes some men, from the beginning, they will use the condom all right, but during the process, they can remove it without the knowledge of the woman. So you think that it's being used, but in the process, it's being removed. But if not, I think the use of condom will be best because sometimes some people also can tear the tip of it.
Sometimes we enjoy message, we tend to forget ourselves. Some the women who force the men to move it. It's not only the men. Some women who have been doing that. So we can't blame the men. Some women too have been doing that. So like saying, I think we will all vote for abstinence. So please, be your health education. Kindly throw more light on what abstinence and be faithful to what Because if you are faithful, I don't think there's any need for what? There's no cause for what? Alarm. Since you are all faithful to each other. So we will end here, okay? And God willing, next week we will continue. But it's a tomorrow for you. 7 p.m. So we will call it a day. Yes, Mary, you want to? Yeah, hello, Mary. Talk to us.
Sister, for how long will the system be opened?
It's for 24 hours.
Yes.
Yeah. So it's starting from tomorrow, 7 p.m. So it is for 24 hours, okay?
All right, thank you.
So I wish you all the best. God willing, next week.
Sister, please, Aries.
That is for everybody.
It's for, yeah. The quiz is for everybody. The quiz is for everybody.
Please, Aries.
These are MCQ. So MCQ does not have periods. All inclusive.
Oh. Sister.
All inclusive.
Sister,
Okay.
please ask a question.
Last week one.
Yeah, people are complaining of the main semester. The main semester did appear. It was for those who had difficulty. It wasn't for everybody. But the for everybody. Everybody.
So this is the quiz, right, sister? Please.
Yes.
Sister, please come again. I don't understand.
The main semester that is appearing. It is for those who had difficulty in the first one. There are some people who couldn't attempt.
Please, the child is making noise. Please, what is that? Hey.
Okay. Madam, I can't hear anything.
Hello.
Yes, sister.
Yes, sister.
Please, can you come again? We don't hear you.
Who couldn't attempt? So that wasn't for, and it's starting tomorrow, 7. So we will call it a day, okay? Right.
We didn't hear well.
Yeah, the network was breaking.
What I'm saying is, hello, can you all hear me now?
Yes, sister.
Yes,
Yeah,
please.
I'm saying the quiz is for everybody. The quiz is for everybody. But the main semester did reappear because some people couldn't attempt. Yeah, so it was for a grace period for them. But this quiz is for everybody. And it's starting tomorrow, 7 p.m. And it's for 24 hours. Okay? So I wish you all the best.
Thank you,
God
sister.
willing.
Thank you,
All right.
sister.
Thank you, sister. God bless you.
We call it a day. Yeah, somebody wants to say something.
From 7 p.m. to what?
To 7 p.m. It's 24 hours. It is for 24 hours.
24 hours. So 7 p.m. to
Thank you,
Monday.
sister. All of us.
7 p.m. to 7 p.m. on Monday.
Yes.
If you please, is the quiz for everybody? Hey,
Yes.
Yes.
again. Hey, monster.
So bye bye. Next
We
week.
didn't hear. That's why we are
Bye
happy.
There's quiz for
Bye.
everybody. That is for those who couldn't attend.
Okay.